Hi, my name is Natalie and I'll be presenting on a patient. So MG is a 15-year-old Asian American male who presented today at the clinic with swollen lymph nodes for 2 weeks. Patient first noticed these lymph nodes suddenly 2 weeks ago on the right side of their throat, and they described them as small, firm, but mobile and slightly tender. Patient denies fever, chills, night sweats, any recent travel. They just endorsed this small bump on the right side of their neck. They're denying headache, stiffness of the neck, or any pain in their neck, ringing of his ears, difficulty hearing, pain or discharge. Patient denies runny nose, congestion, but does endorse seasonal allergies, which in the past he's been treated with allergy meds, but can't remember the name at this time. Denies a sore throat, pulm, any shortness of breath, wheezing, difficulty breathing, cough, and congestion are also denied. Patient does have past medical history of those seasonal allergies, which he can't remember what med he was on, but no history of asthma, no past surgical history, and immunizations are all up to date at this time. However, the flu shot has not been given yet this season. Family history, father just has history of diabetes and cardiovascular disease. And patient medications that they're currently taking, he's on vitamin D. It's the 1,250 microgram capsules that he's taking once daily. No known allergies for this patient. However, they do endorse seasonal allergies. No known medicational allergies, I should say. Review of systems. So patient is afebrile, vital signs stable at this time. They're oriented to person, place, and time. Upon inspection, I did palpate the right superior cervical lymph node. It was less than 1 centimeter and mobile and tender. I did also note some clear, thin mucus and pale, boggy nasal mucosa for the patient, along with in the back of their throat some mild erythema on the tonsillar pillars. Tonsils were visualized without any swelling or redness. And lungs did sound clear on auscultation. Respiratory rate and rhythm were regular, and chest expansion was symmetrical. Differential diagnoses for this patient includes mono, which is unlikely as the patient doesn't present with a fever, have any fatigue, or splenomegaly. Second differential could potentially be bacterial infection. This is also a lower suspicion at this time as patient endorses more symptoms consistent with allergies, has no TB exposure, no swelling of tonsils, or any other skin findings. So at this time, I'm going to diagnose the patient with an enlarged right cervical lymph node secondary to allergic rhinitis and post-nasal drip. So I don't need any labs at this time, but I do want to ask the patient if they would like to be referred to an allergy doctor, and so we can pinpoint some of these seasonal allergies and better treat. But pharmacologically, I would like to prescribe Zyrtec 10 milligrams and have them take this tablet every day for allergies. They should take this medication at bedtime as it can cause some drowsiness. Non-pharmacological and education, I just want them to increase their water intake so they can help assist the lymphatic drainage system and ensure that they're sleeping at least 8 hours per night. And if they have any questions or concerns, to call back our office Monday through Friday. If they do develop a fever or the lymph node grows in size, or if they develop any other lymph node swellings, they can always call and schedule an appointment and come back. And then they should call 911 if they're having any trouble breathing or if they feel like this is a true emergency. Thank you.